Does anybody have any questions while I'm just having my computer start up before we start the review? Anything on the study guide that you had questions about? Okay, just give it 1 second. I'll be up in 1 second. Alrighty, sorry about that. I had a change computers on us. Okay, so we're gonna take a look at the PowerPoint that I have for exam 2 review, and we will take a look at that. So we first start off with, we take a look at consequences of poverty in our rural areas, which we know we've talked about quite a bit. And so we know that in the poorer areas, we have a lower education. So we have highest risk are our kids, minority groups, and ethnic groups. So remember that. Single parent families, especially those that are going to be headed by a woman. And among racial minority groups, we're going to see Hispanic at the highest rate. Okay. I'm just gonna Sure, I just need to make sure we're recording. Okay. Okay, so we have that in our rural areas. Number of college degrees is far lower than those for our urban residents. So this gap we know has increased over time, and what that does to unemployment is going to increase our unemployment as well. So something to think about when we're looking at our rural communities. Our farmers, you know, that's who we find in those rural communities. So I have some pictures here for you guys to look at. The physical demands of harvesting crops 12 to 14 hours a day takes a toll on the musculoskeletal system. Back and neck pain were the most common types of chronic pain. And we had low back pain. When it radiates to one leg, you guys should be familiar with sciatica, and that's consistent with a herniated lumbar disc. So the nurse is going to assess the client to see whether the pain is aggravated by events that increase interspinal pressure. So they do things such as it gets worse when they bend or lift or sneeze or cough, okay? So remember the kinds of work they're doing, and that's why we're worried about it. Our health risks in our rural communities, we know we're less likely to see them participate in leisure activities. We have a decreased compliance with safety precautions. Chronic disease is going to be more prevalent. Clients who live in rural communities are going to know each other. We talked about this in class. So there's going to be a lack of trust among the rural communities. So they're not going to report things such as abuse, depression, drug use, that kind of thing. Okay. We look at our primary, secondary, and tertiary types of interventions. We're going to have our primary intervention would be providing education and teaching workers how to reduce their exposure, provide hand washing stations, and conduct screenings is going to be secondary. And initiating treatment like with nausea, vomiting, and skin irritation is going to be our tertiary. We know we have an overall decrease in health status with our rural communities. Their chronic disease is going to be more prevalent. So I'm re-emphasizing that again. Can everyone see the screen? Can someone just let me know?
Yes, I can.
Okay, thank you.
More to it than.
We also want to take a look at our cultural considerations when we're looking at our Mexican culture. The nurse is considered an authority figure who should respect the individual, make sure be able to relate to our Mexican culture, and maintain the individual's dignity. They expect some sort of rapport, like personal chit chat before any encounter, before addressing any problems, okay? You also can touch them. Touch is seen as a safe thing among our Mexican culture. Families with children are our fastest growing segment of the homeless population. Excuse me, single motherhood is increasing. We see a direct correlation existing between lack of education and poverty. And we've talked a lot about that. Poor teens are nearly 3 times more likely to drop out of school as their non-poor counterparts. When programs that assist the mother to complete her education, that's what we really want to push. So important to keep our pregnant teens in school during their pregnancy and have them return as soon as possible. Homeless access to healthcare, something else we've seen. It has a big impact on our economy. It's usually crisis oriented, right? Because they don't have follow-up care. And so cost of service is going to be very high because it's emergency care. Our homeless adolescents living on the streets are going to exhibit greater risk behaviors such as earlier onset of sexual activity, high risk of contracting diseases such as HIV and hepatitis, most likely to use drugs and alcohol. So when we look at HIV, one of our infectious diseases, we know that HIV is transmitted through sexual contact and exchange of blood fluids. So individuals who have used IV drugs, individuals who experience persistent and recurrent STDs, and individuals who have multiple sex partners are going to be at higher risk. Community mental health providers can help prevent a culture of youth violence by creating activities to increase social skills. So we see an increase in social skills, sees a decrease in violence. So it's one goes up, the other goes down. We want to remember the dangers of mixing drugs, medication, and alcohol. What kind of discharging would one do with medications that suppress the central nervous system? What do you think? We're going to tell them not to do.
Don't drink alcohol.
Good. Don't drink alcohol if you're taking barbiturates, right? Because it's going to depress everything. Psychological dependency with chronic use. We see our risk factors, including violence, trauma, genetic connection, and mental illness. And what would we be sure for primary and tertiary points of vaping for our parents? What are we going to teach parents about vapes? Anybody know?
They cause long-term lung effects in a negative way.
Yep, they're going to cause long-term effects. We're also going to see those vape oils, right? What's bad about the vape oils?
They're toxic.
Harmful chemicals in them.
Yeah, they're harmful. So a little kid gets their hands on them, it can be poisonous to them, right? So I want you to think about the little ones when we're talking about vape. All right, sorry about that. And we're going to go back to our screen again. I just needed to grab some water. Hello. All right, so we look at our dependency, we know about that. What else are we going to take a look at? We're going to see, we just talked about this, vape oils being poisonous, so remember that. Teaching our parents. We had two different types of nursing. We had parish nursing, which we talked about last week, congregational versus institutional. Remember, our congregation has the word congregation right in it. So you're going to focus on one specific congregation. And it's going to be take care of one large group all by yourself. So it's very autonomous, congregational. Institutional is where you really act like the tie between the outside community and the religious entity. So think about, we're going to help people care for the community with outside sources like community centers, doctors. What are some other community resources we could help? If we're doing institutional, who else are we going to work with? To help our patients be more successful? Nothing? How about doctor's offices, pharmacies, needle sharing clinics, right? All those kinds of things. So think about that when you're doing institutional. The parish nurse and primary interventions you're going to see with parish nursing is whole classes with youth and parents on healthy eating, right? We're going to encourage a variety of activities and discourage extended inactivity. We're going to encourage healthy snacks and meals at any sessions we have at the religious meeting. Encourage parents to be proactive in school parenting councils in a neighborhood. Secondary prevention, we're going to do weight screenings, and tertiary, we're going to do weight support groups. So this is really if we're dealing with an obese population, okay? Oops, going the wrong way there. All right, care plans. We know that it's ADPI, right? Assess, diagnose, plan, implement, and evaluate. So when we're discussing health problems and limitations, we're gathering a history as part of our assessment. We create a diagnosis, and then our planning is going to occur after the outcomes have been identified so that a plan can be made. We had two different types of federal healthcare. We have Medicare and Medicaid. Please remember, Medicare, you're dealing for 65 and over. Medicaid, you're dealing for financially compromised. Remember, with our Medicare, we need to have a nursing skill in order for it to get reimbursed. So you can't have something like a sitter or somebody help me get dressed and get reimbursed with our Medicare. Oh, sorry. So here we compare the two. Please know the difference. Medicare is 65 and over or disabled. Medicaid is going to be lack of financial resources. And we re-emphasize here again about our health care, and we know that it's only going to get paid if it's a skilled profession that's nurse bound. What kind of skills are nurse bound?
Wound care.
Good, wound care. What else?
IV antibiotics.
Good, IV antibiotics. How about our diabetics, teaching them insulin management, proper use, that kind of stuff, right? Those are going to be our nursing skills. So it really looks at our cost. Medicaid is not much of a cost. There are some co-pays. You have to be 65 and older. Enrollment for Medicare is going to be really following the 65th birthday, and Medicaid can be available at any time for low income and some disabled. What is our primary goal of hospice care?
To provide comfort at the end of the life for a patient.
Excellent. Dignity is a big one, right? So quality care and comfort. Some federal agencies that help with community nursing we want to think about: World Health Organization, OSHA. Remember, OSHA is our occupational safety organization. And then we have the Agency for Research and Quality, which is going to be for our nursing. We had a couple chapters on epidemiology. So epidemiology, remember, is the study of why do things happen and how do they happen. So we look at our health-related states or events in a population, and we use that information to help control what else could happen. So analytic is when we look at the cause of the disease and deal with why is it happening. So you're going to answer these kind of questions. With analytic, you're analyzing. So you're going to, how does it occur? Why are some people more affected than others? Excuse me, I have a terrible cough. We have our epidemiological triangle that we talked about: a host, environment, and agent. Remember, a host is going to be who gets what and who gets what. So it's going to be based on their age, sex, genetics, immune status, religion, that kind of stuff. Then where do they live? So how does that impact illness and wellness? Their temperature, is it a crowded housing? Is it a prison? Is it really tight quarters? In our college age kids, we worry about meningitis because it's so close. They live so close together. And then the agent, was that bacterial? Is it viral? Is it something poisonous? Is it physical? Okay, so we're going to think about those. We have a rate that I want you guys to know. The case fatality rate is the proportion of people diagnosed with a particular disorder who die within periods. So when the patient asks you, how long do I have to live? That's your case fatality rate. And individuals with immune deficiencies are at our highest rate for illness after consuming contaminated foods or water. So remember that. Environmental health was a big piece of where do you live? What's the water like? What's the land like? Okay, so those kind of things. We're going to reduce as much as we can what work sites that are not safe. We're going to increase the places where we teach about nutrition and well-being in the workplace. So how's it impact our health? Air pollution, water, chemicals, radiation, all those kinds of things, and how does it impact how we are feeling? All right, we look at some objectives that we had with Healthy People 2030. We're looking to increase the proportion of people with safe drinking water, proportion of schools with policy and practices to promote health, and reduce the number of days people are exposed to unhealthy air. So sorry. There's several different type of studies that you guys looked at with evidence-based practice. Please be familiar with them. You have cross-sectional, which is going to be a description of the scope of the problem and estimates about it. Provides like a cross section, like we get current health status and figure out how did they get sick or how did they get exposed. We have retrospective, which means we go backwards, we go retro, and we look at what has happened and we look at records for that. We had a whole chapter on occupational nursing. We know that they work in all kinds of different settings: traditional, manufacturing, industry, construction sites, and government settings. And occupational nursing is a big piece of community health. So those are our main concepts that we're looking at on this test. I go through the PowerPoints with you guys so that gives you something to look at. If you want to, you can listen to the recording and review it. That's always helpful. Were there any topics not covered that you guys wanted to cover? Anything on the study guide that you thought was not clear? Anything like that? 50 questions like last time. You guys know you have 2 sources to bring, a phone and a computer. It will be recorded on Zoom.
No, you did. I think you covered everything. Yeah, I need to be quiet for a second. I think you covered everything.
Okay, thank you, Tamika. So I cover everything on the study guide and I do it on PowerPoint. Sometimes I do go through it quickly and it appears tonight we went through it quickly. If I don't have any other questions though, I'm going to send this recording to all of your professors and they will be able to post it for you. If you need to review anything, you know how to contact me directly. Otherwise, have a good night. And if there's no more questions, take it easy.
Thank you.
Thank you.
Okay,
You have a good night.
you too.
Thank you.